I'm a pathologist at Mayo Clinic, Florida. I diagnose cancers by looking at biopsies and samples under the microscope. So pathology and oncology are very closely intertwined. So the oncologist sees the patient after they get diagnosed with cancer. Usually another doctor, like a primary care physician or a nurse practitioner or a physician assistant, or somebody may be seeing a patient, and once they figure out that the patient has a lesion, like looking at a chest CT or a radiology of some kind, they have to go get it biopsied. And once it's biopsied, then I'll take the tissue, assess it, and ensure that it's truly cancerous. And I'll further subtype the cancer and grade the cancer and do any additional testing I need on that and ensure that I have good tissue. Once I have that tissue, the oncologist will treat the patient, and they may say, hey, to me as a pathologist, can you do some more tests, or can you send it out for this kind of testing? So I know all of the treatment options available for the patient, whether it's chemotherapy or referral to a surgeon or referral to a radiation oncologist who will radiate the tumor. Do I see hesitancy in the black population here in Northeast Florida? I would not say it's hesitancy. They're very interested in their health. As you can see by the turnout of this function that we're having today, people walked here, people came here to learn about this, and they want to learn. The terms are very technical, but I see that people are very attentive. There's not a lot of people on their phone. They're very interested. I believe it is an access issue where they don't know where to get the information, or they don't know where to get reliable information. I mean, there's so much social media and AI, they really want to hear from the experts. And once they find out the information, it's also a great support group, so they can support each other and sign up for different groups and clinical trials to help get the treatment. So I don't know if, people always wanted to say it was hesitancy, but I think that it may be access to experts. I think that it's getting harder and harder to see a doctor or a nurse practitioner or have a primary care provider. I feel like we talk about the haves and the have-nots, we talk about status symbols. Having a doctor is a status symbol. If you have a family physician or an internal medicine doc that you can see, a nurse practitioner, go see it. It doesn't matter what you have in your pocket or what you're driving, but it's just hard to get access. Don't be afraid. Take advantage of what you've earned through your employer, whatever health insurance you signed up, use it or lose it. And don't be afraid to use your benefits and find out what's going on with you, find out what's going on with your family. I always say there's never been a better time to be sick, because the treatments they have now are better than what they had 5-10 years ago. And you've got to take advantage of what you have and use it to the fullest capacity.